When it comes to IVF treatment, sometimes couples need to go through multiple cycles of IVF. So, do you think that this multiple cycles would be unnecessary? It was not needed, and the IVF treatment was done. No, it is not necessary that any fertility expert, when you are going through that IVF treatment, the intention is to achieve the desired outcome to get that result, isn't it? But at times you are required to go through multiple attempts sometimes, because then it is not with some intention, but then definitely there is some other factor that is not working at reproductive level, and you need to go through multiple attempts. Now, if you have to go through multiple attempts, it is needed. You shouldn't be losing that hope, because you know at many times we see that one cycle may not result into good number of embryos or good quality embryos. You may need to go through multiple cycle to get good number of embryos, and only then you'll be able to achieve that pregnancy, that joy that you were looking for. So, hey, hi, I'm Dr. Indu from Samruddh Fertility and Urology Center, and today I'll be discussing about few stories which revolve around how couples were really very persistent, and they did not really lose hope, and they had to take several cycles at IVF, and finally they could achieve their dream of parenthood, their dream of motherhood. So when it comes to multiple rounds of IVF treatment that some of the couples have to go through, it could be for the reason that in the first cycle they formed very few embryos, and it did not result into pregnancy. It could be what are the reason for going through multiple cycles? One of the commonest reason is when the woman is having low ovarian reserve. She does not have good number of eggs, and she makes only around 4 to 5 eggs in one cycle. And when the fertilization is done and when the embryos are formed, then we get only around one or two embryo for that cycle. And if the embryo quality has been average, then the chances also decline in such a situation. Then do you think that here one more cycle is not needed if this embryo did not result into a pregnancy? They need to go through another cycle, because only when they take another cycle, there will be another few eggs that will be retrieved, another one or two embryos will be formed. So that's how some of the women. This is one of the commonest reason why women will have to take multiple cycles. So only the importance of age, because with increasing age this number of eggs decline, and for a successful IVF the number of eggs is actually very very critical to have a very good number of embryos available for transfer, available for even future use, frozen for if fresh cycle doesn't work, then frozen ones can be utilized. So that is one aspect. Another aspect is when the sperm is very low in number, and couples are not willing to go for the third party reproduction. That is, they don't want to go ahead with the donor sperm. Here again, your IVF treatment result will decline if you are going through your own genetic material and you are wanting to try your own cycle. Then if one cycle has not given you a good number of embryos, then it becomes necessary that you have to take another cycle of IVF, or maybe two or three cycle of IVF to get that number of embryos that is required. Now another scenario is where sometimes it is unexplained. You don't know why didn't work. You have embryos. You have around in one cycle you grow some 4 to 5 embryos. You get transferred. It doesn't result into pregnancy. Then you take the transfer. Some 3 rounds of transfer happens. Then again you are like thinking, should I go for one more cycle or not? So yeah, these are the dilemmas when you are talking to your fertility expert. Then they will definitely give you clarity on as to why one more cycle will be needed. Because sometimes giving that time, giving that a gap of a month, two, or 3 4 months, and then starting correcting some other correctable factors, and then taking the treatment might give you result. So do not like consider this as only one cycle should work, and if it works, that's it. Otherwise, it is not possible at all. So for some of the couples, it may be possible that you may need to go through. several attempts. Maybe a pickup cycle may be one or two or three, but when you form more number of embryos, then the number of embryo transfers that you might go through may be more. So I would say you should not lose hope, because when it comes to IVF journey, it is a very, very emotional journey, and the amount of support that you need on an emotional front is enormous. But do not lose hope, and you have to be persistent. So with this, I would like to share a story about one or two stories about how persistence really helped this couple achieve pregnancy. So here is a couple who comes to me with a wife being around 32 years of age and husband 35 years of age. This couple has had one IVF elsewhere in some other city, and there she had got, I mean, she directly went for the IVF. She was married for around 5 years, and she thought because IVF gives a very good success rate, they tried only for around 6 months and 6 to 8 months, and that really did not give them the natural pregnancy. And couple were really eager to take IVF treatment because that gives a very good chance compared to IUI treatment. So this treatment was done in some other city, and there, for her age, she got only around 6 eggs. She made only around 2 to 3 embryos, and that too on day 3. And these embryos were not transferred in the fresh cycle, but in a frozen cycle. In the sense, embryos were frozen and it was transferred as a frozen embryos. This did not result into pregnancy, and this couple were really devastated that they went with IVF and it did not result into pregnancy. The number of embryos that she formed was also less, and this was very, very disheartening for her. So she comes to me with this background. Now I said that you look pretty young. You are 32 years, and the husband is also only around 35, 36. So let us do some basic tests, because that those tests were not done at all for them, because they wanted to take IVF directly with the intention that that gives them the best chance. Now, I said, okay, you have had a very traumatic phase. Let us do or see if we can do some simple treatment, because we have not, an assessment is not done. So when the tube testing was done for this woman, what was found was that she had on both the sides, the tubes were dilated, the tubes were damaged. When I say tubes, this is the fallopian tubes which are on the sides of the uterus. These tubes were damaged, which was picked up on an X-ray test called HSG, that is a tube test that is done. So this comes as a shock for her, because she never had any symptoms. So you need not have any symptom here. So okay, so then the discussion was done. The counseling was given that with a damaged or a diseased tube, definitely a spontaneous natural conception or a simple treatment like IUI is not possible. First of all, one has to go and do a laparoscopy and then kind of deal with these tubes. If they're really damaged and diseased, it is good that it is removed. So this counseling was given to this couple, and they took their time and they decided that okay, they'll go ahead with the laparoscopy, and if the tubes are really bad, they had given the consent of removing both the tubes. Now laparoscopy was performed and both tubes were removed because they were looking damaged. And the counseling of what happens if both the tubes are removed, what is the impact of removing both the tubes on the ovary and its reserve, all this was discussed before, prior to the surgery, and the couple were very clear, and they understood all the advantages and disadvantages of doing this, and they went ahead and took this decision. So this was done, and because her ovarian reserve was also like borderline, so she was given few antioxidants and other vitamins, and she had to break for at least 3 to 4 months. So this is the time that she had to wait, and then she decided finally that she'll go ahead with the IVF treatment. Now, looking at her past experience of IVF, where she got only 5, 6 eggs and she made only 2 or 3 embryos, same explanation was given to her that this is possible because one IVF cycle gives us an idea what a woman is going to have as a response in the next cycle. So she goes through the standard ovarian stimulation, and we were expecting around 7 to 8 eggs with the stimulation that she received. And this was then egg pickup was done. In egg pickup, we got around 7 eggs, but she could form around 5 embryos, and that too day 5 embryos, out of which 3 were top quality, the other 2 were like B grade. So At that end of that treatment phase, she was really very happy that she got good number of embryos, and that too on day 5. So this was a very happy thing for her, because she had a normal response. We did the fresh embryo transfer, and that did not result into a pregnancy. So this was again a jolt for her, because when the couple starts their treatment, they start with that intense ambition or intense desire of achieving that pregnancy. This did not result into a pregnancy. So she had to take another attempt. So this was kind of third transfer for her. She had another 4 beautiful embryos in the storage. So she was ready to take this embryo transfer in the next cycle. And what we did was, it was in a natural environment. So a natural embryo, a natural cycle monitoring was done, and the right day was determined by a few tests, scans, and all those things. And only one embryo. She wanted only one embryo, because she was very clear she doesn't want twins at all at any cost. So even the fresh was single. The second time also we transferred a single embryo. That was also a very beautiful embryo, and then this resulted into a pregnancy. She went through the 9 months very smoothly. In the end, there were some, at the end of her pregnancy phase, there was some issue with liver enzymes going higher and all, and so she had to undergo a cesarean. That was at the end of the 9th month. So she had a very beautiful outcome at the end. So what I would say here is that, this she achieved nearly after about 2.5 years from the time she started her IVF journey or a fertility journey. So this was her persistence, and this was her hope that she kept, and the faith that she had on the entire process. So this was about this patient. So these were the stories about a few of the couples who had the long journey, and how they achieved the pregnancy, and how they could really achieve their dream of parenthood. So I would say that there are many such stories about many couples where they had to undergo many transfers before they could achieve the positive result. So this is what I would like to say, that you have to definitely understand what is the reason, what is the cause for pregnancy not happening. And sometimes one is able to handle that problem efficiently and achieve the result very faster. Sometimes the things are unexplained, and when it is unexplained, then you have to have that persistency, you have to have that hope that things will work for you, and you need to have that faith also on the treating consultant, that what is being planned, or how you are guided by the expert, you will be benefited. And definitely this will be told to you by the fertility consultant as to when you should call it off and say that okay, enough is enough. This is again in a conversation with your expert, because only when you have that clear conversation as to how many attempts, how many cycles, and when to say that okay, these many attempts are enough. But then what I would like to say here is that you should not lose hope. Sometimes you need more than one cycle, sometimes you need more than 4 to 5 transfers. And especially when you want a very beautiful outcome of carrying a singleton pregnancy, then if you are wanting to go only for a single embryo transfer, then the number of attempts of transfer may be more compared to those who go with double embryo transfer. So this is what I would like to say. So whatever is your choice, whatever is your preference, discuss it out with the doctor, with the fertility expert, and remember that there is definitely a hope with the IVF being reaching such a stage where we are able to store the embryos, we are able to make beautiful embryos. So achieving a pregnancy is definitely not very difficult. It's just that sometimes you need to undergo multiple cycles, but I think that is okay. Finally, what you are desiring is to expand your family and to bring that bundle of joy in your life, and which really makes your family complete, isn't it? So I think this story, and the story of hope, the story of persistence, helps you. It resonates with you, and if you think that this is going to help someone to take their decisions, then do share it. And for more such content, you can definitely subscribe to our channel. So signing off, Dr. Indu.